Hi and welcome to India. We're here at the 37th annual Bidada Hospital camp. Today we're going to be showing you the 21st annual ENT camp, which is the ears, nose, and throat. The last 3 days they've gone into the villages and screened the patients, and now they've brought all the patients that need further screening, further diagnostic testing back to camp. Here we'll take a look at the outpatient screening facilities, the further testings they do, and then we're going to follow them into the operating room and see what kind of surgeries they're doing in this very remote part of India. Let's take a look. All right, we're in the village of Bidada. We're just outside the hospital entrance gates. This is what mostly village life looks like. These are small rickshaws, small little trucks. It's a very simple life. I'm with Dr. Houria. He's one of the founding members of the ENT, Ears, Nose, and Throat program. So I just wanted to ask you a little bit, Dr. Houria, how did you get involved in this amazing hospital we have established here?
When I came here once from America, they were working in a very small place in an animal shelter. And the way they operated, I was amazed. So I got involved a little more and gave some money to help build this building. My father was a qualified physician in village in 30s and was serving this area, and that inspired me to come back and do more. As an ear, nose, and throat and head and neck surgeon, I've operated on several patients here. It has evolved into a major mega campus in a small town, and I'm very proud of it. Thank you.
Thank you so much for all of your help. It's really amazing what happens here. We appreciate it.
Thank you so much.
This is the patient registration area. There was 3 clinics completed in the local villages. Now the patients have been told to come on a specific day for the ENT camp. They'll come here and be registered. They'll wait then in line to see the doctor. This local village girl is unable to speak properly, so she's being brought here by her family to be evaluated for hearing tests to find out why she's unable to speak. Here's another patient example. This patient has come a long way to see the ENT doctors. He has multiple neck masses, which have also been draining. We're here in the audiology room. I'm with Mr. Shaker. He's an audiologist. He's performing an audiogram right now. He will perform more than 80 of these today. So this patient has already been through the OPD testing, where the ENT specialist ordered the audiometer testing. Right next to the audiology testing is Vijay Cheda. Vijay Cheda is one of the trust members, and he's been a trust member for over 30 years. He's responsible for most of the day-to-day operations that happen here at the camp. So how is the camp involved with providing service for the audiology patients?
If the patient requires surgery, we perform the surgery over here, and there were more than 75 to 100 surgeries will be performed during the ENT camp. And if the patients require the hearing aids, we provide them a free hearing aids. We receive the free hearing aids from the UK, USA, and from many parts of the countries also. And we sometimes buy our own the hearing aids. And people, if they cannot afford it, we provide them free of charge the hearing aids to the many older people. Thank you very much.
Thank you so much, Vijay, for all of your years of service. This patient is, the lay term is tongue-tied, which means the inferior aspect of the tongue is still attached to the floor. So the surgeon is going to go in this little boy, and he's going to release that tissue that's keeping the tongue adhesed to the floor of the mouth. So we'll kind of follow him as he does this procedure. The surgeons have put him on the table. They've given him an anesthesia, and they're actually cauterizing now that connective tissue at the inferior aspect of the tongue. So here's the final result. His inferior tongue has been cauterized, and the doctor's just suctioning and checking all the margins, and it is a successful release of this case. I'm here with Dr. Bave. He just finished his ear surgery. He's here from Mumbai. He's been coming back to the camp for the last 11 to 12 years doing ear surgeries. So I'm just going to ask him a little bit quickly to describe the procedure you just did. Thank you.
Okay, this operation is called stapedectomy. It's done for a conductive hearing loss in the patient, which is due to the innermost bone for hearing. That is called a stapes, which is incidentally also the smallest bone in the body. That gets stiff due to a disease called otosclerosis. So we have to remove it, make a hole in the stiffened footplate, and replace that chain with a Teflon piston. The Teflon piston is biocompatible plastic piston which conveys the sound inside.
Thank you so much for your years of service. It's a very delicate procedure. Dr. Bave is doing it all under microscope, and again, it takes a very skilled hand. He's going to insert a prosthetic device after he actually has just removed the superior stapes that was fixed from the inner ear. And now he's going in and he's going to put a new prosthetic piece in, which is happening right now. Okay, Dr. Bave is now checking the hearing. Now that he's restored the new hearing apparatus, patient's under local anesthesia, so he's actually able to whisper in her ear and he's able to check it intraoperatively while he's still in the middle of the procedure, and she is responding positively that she does have full restored hearing in her right ear after surgery. This is Dr. Agrawal. He's doing a tympanoplasty. The patient had a perforated right tympanic membrane, so he's cleaned up in there, and now he's preparing to put in the new tympanic membrane. This is going to be a temporalis fascial graft. After seeing this camp, hopefully you'll have a true appreciation for the manpower and planning that goes into performing so many high-quality surgeries in a very remote village in India. This camp is 100% funded by donations. There's no cost to the patient for the hospital stay, the food, the medicine, or any follow-up care. We appreciate all your donations and hope you continue to support this very important cause.